Hello everyone and welcome back to A Year in the TikTok of Fat Doctor UK. We left off here and we still have all of this to fucking go through. All of that. And chances are I'm only going to get through about 2 rows worth of TikToks. Typically, that's about what I get through. You know, we're just gonna start.
I get this question over and over again. You're not the only person whose doctor is more interested in making you look thin than they are helping you to feel better. And whilst nobody should have to advocate for themselves in the doctor's office because the doctor's supposed to be advocating for you, the reality is if you are fat, then you're going to have to learn how to do it if you want to get anywhere in life. So my first question would be, is it that you're being denied surgery according to local guidelines which have a BMI cutoff? If that's the case, then it's usually a funding issue and you should be able to appeal the decision. That's actually quite complicated, and I'm trying at the moment to work on some resources that you can use to help with your case. If it's just the individual doctor who is refusing or gatekeeping the surgery, then I suggest you ask to be referred for a second opinion to a weight-inclusive doctor. They probably won't know what that is, but ask anyway. I get this question.
So, a couple of different things I wanna touch on with this TikTok. One, the idea of advocating for yourself at the doctor's office, and she's saying, you know, you shouldn't have to. Doctors are supposed to advocate for you. Like, I agree to an extent. At the same time, doctors are human, and I think that to a certain extent, this kind of creates this very unfortunate perspective that doctors don't have your best interest at heart, when I think most doctors do. It's a matter of what she called gatekeeping the surgery might be due to potential risks, maybe putting you under anesthesia, maybe getting you off, maybe the likelihood of success is affected based on your weight. I don't like this perspective that doctors are just gatekeeping surgeries because they don't want you to get better, they don't want you to be healthier. No, chances are typically doctors do their best and they address the most likely cause first. When it comes to surgery, they may deny it for you until you lose weight based off potential risks. Doctors, at least to my understanding, are constantly kind of weighing potential risks versus the potential benefits for the patient. And the benefits have to significantly outweigh the risks in order for them to recommend it typically. I mean, perhaps I'm wrong here, and feel free to correct me if I am, but this just kind of feels not disingenuous, but is very slanted.
Just to be clear, I am never going to advocate for weight loss surgery. I totally get why you misunderstood me from my last video, so I'm just trying to clarify. The purpose of weight loss surgery is twofold. The obvious one is to make you lose weight. The second one is it supposedly helps to reduce quote-unquote weight-related diseases. Now, already I take issue with this because there is absolutely no evidence that carrying excess weight, whatever that means, causes any disease. There is also little evidence that if you lose weight, it will cure diseases. If you check out this study, you'll find that over a third of patients who went into remission from their diabetes following weight loss surgery actually relapsed within 5 years. The risk of surgery includes hemorrhage, pulmonary embolism, infection, gut leaks, and of course death. Long-term complications include poor mental health and increased rates of suicide.
Okay, first thing, the original comment was, oh, I didn't expect you to advocate for weight loss surgery. Some people say it takes such a toll on the body. The previous TikTok that we saw said, what can I do when I need surgery and all my doctor focuses on is that I need to lose weight? And then in parentheses it says endometriosis. So I do think that the commenter from the previous video just misunderstood what she was talking about. She was talking about surgeries in relation to endometriosis, I believe, rather than weight loss surgery. What I want to see is this study. So comparing the 5-year diabetes outcomes of sleeve gastro... I can't I can't talk, but it's gastric bypass. Okay. Okay, so this was another one that was behind a paywall. I am curious about the National Patient-Centered Clinical Research Network. So it looks like it's just a group for patient-centered research. So let's take a look. Key points. I love that these have key points up here so we can kind of see. But the question was, how do type 2 diabetes outcomes compare across the two most common bariatric procedures? Findings. In this cohort study of 9,710 adults with type 2 diabetes who underwent bariatric surgery, most patients who had Roux-en-Y gastric bypass or sleeve gastrectomy, I can't pronounce shit to save my life, experienced type 2 diabetes remissions at some point over 5 years of follow-up. Patients who had Roux-en-Y gastric bypass showed slightly higher type 2 diabetes remission rates, better glycemic control, and fewer type 2 diabetes relapse events than patients who had sleeve the sleeve surgery. Meaning, understanding diabetes outcomes of different bariatric procedures will help surgeons and patients with diabetes make informed healthcare choices. So what exactly did Fat Dr. UK say about this?
If you lose weight, it will cure diseases. If you check out this study, you'll find that over a third of patients who went into remission from their diabetes following weight loss surgery actually relapsed within 5 years.
Okay. They said that over a third of them with type 2 diabetes relapsed within 5 years. But that was not the point of this study. The point of this study was to compare two. So was the relapse of the follow-ups those in the sleeve surgery category or those in the gastric bypass surgery? So results, conclusion. So here's like a summary of the conclusion. In the large multicenter study, patients who had gastric bypass had greater weight loss, slightly higher type 2 diabetes remission rates, less type 2 diabetes relapse, and better long-term glycemic control compared to those with the sleeve surgery. These findings can help patient-centered surgical decision-making. So I want to go and I want to read the full conclusions. Percentage of total weight loss. Actually, we'll take a look at the type 2 diabetes remission and the diabetes relapse. So this cohort was followed for a median of 2.7 years, meaning most people were in that range. It's the median, not the mean. So chances are no one was followed for more than 5 years. Type 2 diabetes remission occurred primarily in the first 2 years. Patients who underwent gastric bypass showed slightly 10% higher type 2 diabetes remission rates than those with the gastric sleeve. Sensitivity analysis requiring 9-month and 12-month timeframes without diabetes medication prescription to define remission produced similar results to the primary analysis of its 6-month timeframe, although differences between the gastric sleeve and the gastric bypass were not always statistically significant. Analysis restricted to 8 integrated health systems yielded qualitatively similar results to the primary analysis. So let's take a look at the relapse. A total of 6,141 patients were documented type 2 diabetes remission were eligible for relapse analysis. So that's a little different. I'm wondering if she's talking about this is where they're talking about the remission rate, because all of this is just saying that the 2/3 basically of the patients were eligible for relapse analysis, meaning that they didn't go into type 2 diabetes remission and then relapse. These people were those that were in remission. The other third did not achieve remission, most likely. Let's see, because remission rates for those who had the gastric sleeve. So we estimated that 59.2% of patients who had the gastric bypass versus 55.9% of those who had the gastric sleeve experienced remission by 1 year. At 3 years, or 84.3% at 3 years and 86.1% at 5 years. So that's interesting. If anything, this is saying that type 2 diabetes remission got higher as time went on, not less. But then let's take a look at the remission rate. We're eligible for relapse analysis. The relapse rate was lower for the gastric bypass than the gastric sleeve. Estimated proportions of relapse of the gastric bypass and gastric sleeve groups respectively were 8.4% 1 year after remission, 1 year after remission, 22.2% at 3 years, and 33.1% at 5 years. So this is where the 33%, a third, experienced of those that had achieved remission and were eligible for relapse analysis. So a third of the 6,000, not the 9,000 patients that we started with, but the 6,000 patients, which would put it more at those that had relapse qualifications. Now, I'm getting that the other third just maybe didn't reach type 2 diabetes remission, or perhaps there was some other reason. This is I'll admit, medical journals are not what I'm used to reading, so I could be getting this somewhat wrong. It's right here in front of you, though, if you can figure this out better than I can. But that third, that 33%, is of the 6,141 patients, meaning it's about roughly a sixth of the patients overall, not a third, that experienced the relapse in type 2 diabetes. Limitation, conclusion. Oh, the conclusion isn't that long, so we'll just read it real quick. In conclusion, among patients with type 2 diabetes who underwent gastric bypass or gastric sleeve, most experienced type 2 diabetes remissions at some point over the 5-year follow-up. While gastric sleeve and gastric bypass resulted in similar rates of initial type 2 diabetes remission, gastric bypass was associated with larger and more persistent improvements of glycemic control and 25% lower type 2 diabetes relapse compared to the gastric sleeve. Patients with more advanced type 2 diabetes at the time of surgery, for whom remission is more difficult to achieve, those with older age, insulin use, more complex type 2 diabetes medication, and or poor glycemic control, may expect larger improvements in type 2 diabetes with gastric bypass compared to gastric sleeve. On the other hand, for patients with higher likelihood of type 2 diabetes remission, gastric bypass and gastric sleeve are likely to yield similar 5-year type 2 diabetes outcomes. For patients, clinicians, and policymakers to make informed decisions about which procedure is best suited to patients' personal situations, additional data are needed to understand the adverse event profile of the procedures, as well as patient values regarding procedure choices, the role of surgery relative to other aspects of lifelong weight management. No, I keep saying she. They completely misrepresented the study. That saying that a third of them experienced relapse is to take something that wasn't even the focus of this study. This was comparing rates, and even if we take that 33% from the relapse rate, that 33% within 5 years, at 5 years, is looking at 6,000 patients, not the initial 9,000. So it isn't even 33% of the entire grouping like they claim. It's 33% of the 2/3 of the group from the initial cohort of patients. This was just one great, humongous misrepresentation of the data. And it's behind a paywall. It's behind a fucking paywall, so people can't analyze it the way that I can. I'm using my old university databases again because it was behind a paywall. I had to Thank God. Thank God for my alumni association membership, because without it, I wouldn't have even been able to see this. That's really disgusting. Because it's really, someone had suggested that it seemed like that Fat Dr. UK was choosing studies that were behind a paywall so that way people wouldn't have as easy access to it to challenge what they say. I often assume ignorance before intent, but when you stop and take a look at it, Fat Dr. UK went through all of the medical training to become a doctor. They understand how to read these better than I do, which means that this has to be a deliberate misrepresentation. And likely, as someone said in the comments, a couple people said in the comments, they're likely choosing studies behind a paywall so people can't challenge their perspective. They're not even their perspective, but the information that they are putting from this study. It's disgusting.
Just a reminder that how you feel about your body has nothing to do with how others should treat your body. Everyone deserves to be treated with respect and dignity. No one has the right to stigmatize, abuse, harass, or oppress you because you're fat.
So, on the surface, I agree with this. But in practice, the fat acceptance group tends to take this to ridiculous extremes. Saying that, you know, they deserve full access and, like, better access and dignity and respect is saying that they deserve size 30 clothing in all major retail stores. It's saying that they shouldn't have to pay for an extra seat on an airplane when they are morbidly obese and they take up the space of 2 airplane seats. They say these words and most rational people would agree with them, would agree with these statements outright. The way that these are practiced are often very different than the way most people think of when they think, yes, they deserve respect and yes, they deserve to be, you know, treated equally. FA interpretation of this statement versus the average person's interpretation of this statement are two very different things.
Much as I love being schooled by randoms on the internet.
So before we go further, the comment says, there's tons of academic articles proving being fat is bad for health.
I would like to point out once again that there are no academic articles that prove that being fat is bad for your health. That's all.
Okay. Choice words that they used here. I want to be clear. To a degree, they are correct. They're, well, not to a degree. If we're taking the most literal interpretation, they are correct. I'm sorry that you might hear my nose get stuffy occasionally. We have wildfire smoke again, and it's messing with my sinuses. If we're taking this at its most literal interpretation, Fat Dr. UK is correct. There are no studies that prove. Now, oh god, this is so... It's hard for me to verbalize this right now. Prove. The operative word being prove, meaning that it is a without a doubt fact, the same level that it is a fact that sheep, their floof can turn into wool. Their sheep's wool can be turned into wool for clothing and yarn. You can't say something is proven in a scientific context. It just doesn't really work like that. You can say, you know, this suggests the likelihood, it is very likely, it is, but saying proven, and they are really kind of honing in on that word prove. No, that is not correct. It's a wordplay game. It just seems done specifically to say I'm not wrong when I say that it has not been proven. But the amount of evidence available that being fat is bad for your health is significantly more than studies that say otherwise. Meaning that it is more reasonable to assume that being fat is bad for your health. More studies suggest this. But you have to use the word suggest. By saying the word prove, they can argue, no, it doesn't prove anything, and still technically be right. Because they are arguing the literal interpretation of the words rather than the spirit of the comment. Shit like this irritates the ever-loving fuck out of me.
I hear this a lot. People seem to think there's a difference between a diet and a lifestyle change. Are you pursuing weight loss? Yes? Then it's a diet. Lifestyle modification has nothing to do with weight. I hear this a lot.
That's a fucking lie. I'm sorry, but it's not. Diets don't work, lifestyle change does, and somehow if you are making lifestyle changes to lose weight, therefore it is a diet and not a lifestyle change. That is some fucking dumb shit that I've heard from Fat Dr. UK. I mean, this is one where I think they believe what they're saying. Probably they're playing with words a little bit. If I have a diet where I am eating 1,800 calories, cutting out most processed foods in favor of healthy food and whole grains and fruits and vegetables and all that good stuff, and I am working out, let's say, what I've been doing, which is running more and working on building my strength, and I adhere to both of these things in an effort to lose weight, and I do, then it's a diet. However, if I do these exact same things without the intent to lose weight, but I end up losing weight anyway, it's a lifestyle change. Fucking distinction without a goddamn bit of difference. That is a fucking dumb-ass distinction to make, that just because you're doing something to lose weight, it is suddenly a diet. Not necessarily. Behaviors in order to lose weight can both be in terms of eating and also in terms of exercise. Therefore, the diet thing, saying that if it's just an effort to lose weight, it has to be a diet, is kind of an erroneous statement to make. It's like fucking Kool-Aid, man. It's the fat acceptance Kool-Aid. So the comment says, there are many research papers that do prove this. A simple Athena search would provide you with a list. Again, what they're going to focus on, and I can already tell, is the word prove. You can't really say prove. You can say that there's a lot more papers to support that being fat is bad for your health than there are that say otherwise. So they're going to hone in on this word prove.
Again, I say there are no academic studies that prove that being fat is bad for your health. You can do as many searches as you like, but you will not find them. First of all, it's pretty impossible to prove anything in science, so please get your head around that.
See, this is what I mean. They proved it right here. They're overly focusing on the word prove rather than the spirit of the comment.
Second of all, you have to define health, and since there are over 50 definitions for health right now, that's pretty difficult to agree on. But even if you did agree on a definition for bad health, then you would need to find some evidence to show that being fat does cause bad health. And seeing as there isn't any evidence out there that takes the following into consideration: weight cycling, internalized weight stigma, and disparities in healthcare, all of the evidence that you're referring to is inaccurate and completely useless. Prove me wrong if you can.
So while even if we took the 50 different definitions for health, and you'd have to find a series of research articles focused on one particular definition of health, I think that most people can agree on the higher prevalence of medical conditions like high blood pressure, high cholesterol, and diabetes are symptoms of poorer health. Ultimately, though, and I don't really want to get into this too much, because ultimately what Fat Dr. UK is doing here is setting something up to where you will always be wrong. So you can't say prove, because proving something in a scientific context is just near impossible to do. They say there's 50 definitions of health, meaning that you need to find one universal definition of health, which is nearly impossible to do. And then they say that you need to accommodate for all of these different potential contributing factors rather than simply acknowledging that the trend still exists. But if they don't account for these different factors that they have listed, then the study itself is null and void to them and doesn't count. Therefore, you will always be wrong no matter what you do. It's fucking bullshit is what it is.
You don't...
Alright, the comment is genuinely curious. I would like to be toned and strong. How do I slim down without diet and exercise?
You need to be slim to be strong. There are so many athletes out there who...
But the thing is that they said they want to be strong and toned. Toned, you look more toned when you lose weight.
Who are doing amazing things with their body and are not trying to lose weight. You can be one of those. You just have to accept the fact that thinner is not better.
So I pretty much said what I want to say on that front. Like, it's... You still didn't answer. Fine. We'll take out the thin part, but how exactly would they get stronger without a diet to promote the building of muscle and exercise to train those muscles? You still didn't answer the core of what the question was.
Apology accepted. It's clear from your comments.
Okay, wait, the comment says, sorry that I didn't include the disabled in this discussion purely about weight. Thanks for your input, really enlightening.
That you don't actually care about disability. That's unsurprising, because you just seem to be that kind of a person. But ableism has everything to do with fat oppression.
No, it really doesn't. Because the thing is about ableism is negative treatment of people who have conditions that are completely outside of control, medical conditions that are completely outside of their control. And being morbidly obese is within your control, therefore it's not ableism to say, for example, that you should lose weight to fit into an airplane seat or buy two. That's not ableism.
I think sometimes people forget that.
Okay, so the question is, can you go back to what you do best, stop responding to assholes, and talk to people you help? I'm asking, not telling.
I'm a human being. No one is actually paying me to be here. I do the work of fact activism because I'm passionate about it. Because I know how badly fat people are treated. Because I know how much of that responsibility lies squarely on the shoulders of doctors, of which I am one. Because there are hundreds of thousands, no, millions of people out there that are being harmed by all of these nasty stereotypes about fat people. But I am a fat person, and they harm me too. And I try to engage with you all. I try to answer your comments. I try to be as good an advocate as I can. But I am a human being, a fat human being who has been mistreated as a result of being fat most of their life. So I'm allowed to get angry. I'm allowed to swear, and I'm allowed to clap back at the trolls. I deserve dignity and respect too.
So I think they are missing the point of it. Is by responding to the assholes, you're giving them a platform. Although I don't think that responding to the assholes, I don't think so far the comments that I've seen aren't assholes. They're people that are challenging the misinformation that Fact Doctor UK is putting out. But if we put those aside, responding to people that you perceive as assholes just kind of puts them in a spotlight and continues the conversation kind of on their terms. And I think that's kind of what they are pointing out. But ultimately, Fat Doctor UK is right that it's their TikTok. They're here free of charge. They're here doing what they want. So they can act how they want on their social media. And to be honest, I agree with that. I cover people that I want to cover. And there have been some people that I guess could be put under the troll umbrella. The vast majority of conversations that I've had in my comments and that people have left in my comments have either developed a very interesting conversation that either affirmed what I already thought or challenged what I thought. There, especially in my early videos, there was some talk about how I was kind of going off of the topic at hand and making arguments that weren't exactly fair, as well as arguments that were kind of, for lack of a better term, outlandish, and it came across as me purposely misinterpreting what someone had said, despite the fact that that wasn't my intention. once it was brought to my attention, I saw what they meant, and I've kind of adjusted how I respond to the fat acceptance people in turn. One, because I've gotten better at it, but two, because of those conversations that I've had with people that have influenced my perception and how I conduct myself. So I don't think that engaging with people that you disagree with is a bad thing.
It's a common misconception that knee pain is caused by...
Okay, wait. The comment is, I don't feel the need to be thin, but I have real pain in my knee. What can I do?
Being fat. A lot of people have been told that extra weight puts pressure on their joints and that causes arthritis. Of course, that's not true. Our joints generally are able to...
Except notice, though, that they don't provide any sort of citation for this. There's a couple of different studies. If I could remember their names, I would look them up and put them in this video, talking about how the extra weight that you have compounds on your load-bearing joints. But they don't provide any sort of study to contradict that. They have nothing they can misrepresent.
Repair themselves, but when the cartilage can't repair itself, you develop a condition called osteoarthritis. No one actually knows what causes it, although there's death.
So we've gone through this a couple of different times, but they always loop back joint pain to osteoarthritis when, especially, again, talking with people in the comments and then looking up some stuff to kind of exploring based on what they said. There's many reasons for knee pain, and sometimes no reason at all necessarily nor like it's not connected to a specific, it's not that it's no reason, but it's not connected to a specific disorder or disease, and yet they're boiling all joint pain down, all knee pain down into osteoarthritis in order to make the argument that weight does not affect your joints, it's wear and tear that affects your joints. When in reality, that's a misrepresentation and an overly narrow focus on what could cause joint pain in order for you to be, for lack of a better term, right.
Definitely a strong genetic component. It is seen in people with higher weights or body mass index, but nobody knows if one causes the other, and in fact there are lots and lots of reasons why this association may take place. We do know that injuries, especially sports-related injuries, are associated with the development of early onset arthritis as well. If you have knee pain, please don't assume it's because you're fat. Also, please don't assume that losing weight is going to cure your knee pain. Chances are it won't. What you need to do is find out what's causing the pain and treat it.
And sometimes it's the weight causing the pain. So, I think I've mentioned this before, but I have a lot of hypermobile joints. For me, it's more upper body than lower body, but my lower body has some hypermobility in it too. And I've personally noticed that if I go over the weight of 190, like that is my hard cutoff, if I go over that weight, I start to have some serious back and sciatic nerve pain. But it goes away when I lose weight. So for me, and this is anecdotal, and that's fine. I'm okay with it because this is what I can personally attest to. For me, losing weight directly impacts and assists my joint and back pain. Now, I do my tolerance, the growth of knee and ankle pain does still happen, but for that I have to be closer to the highest weight that I've gotten, which is around like 199. I have never quite reached 200, but I've like bumped right up against it. But when I'm at like that really high weight for myself, even my knees and ankles can hurt, or at least they hurt more often. So weight, it can 100% contribute to joint and back pain. To say it doesn't, and to do this over-focus on osteoarthritis is just such fucking bullshit. Okay, so one thing about this next TikTok. Apparently, Fat Dr. UK has a podcast that explores health in detail. I gotta be honest, I don't think I have the energy, especially since we still have a ways to go through their TikTok. I don't think I have the energy to go through their podcast. But the comment that they're about to respond to says, go for a jog, see how healthy you feel. And the interesting thing about this is unfortunately it's said in a very rude way, but something that is kind of worth trying is, go for a jog. Because you realize how much you run out of breath, how tired your body gets very quickly. To a certain extent, I do think it's a good idea, if you can, to go for a jog every once in a while, and just even using that as like a measure for your health, because it's really interesting and very telling.
I don't get this comment. If I went for a jog right now, honest answer, I'd probably collapse after a few minutes because I haven't jogged in ages. But what's that got to do with being healthy?
Do you really not see that your lung capacity, which a big issue, because I know this because I care for some elderly people, and it was something that the doctor recommended against, was when you sit for a long time, your chest doesn't have as much activity to practice like expanding, because when you're working out and stuff, your chest expands because you're breathing harder, and it just helps move things along, as to where when you're very sedentary, and this is an issue with elderly people who become more sedentary with age or sickness or whatever, it becomes easier for fluid to collect in your lungs. Now, again, I'm speaking for the elderly, and I'm speaking specifically to my situation and the family members that I care for. But it does have something to do with health. The doctor, as I've been helping care for my elderly family members, basically even gave me a free tidbit of, make sure you go through some exercise at least once a week where you get out of breath, because that's how your chest, and not like out of breath where you really can't breathe, but just out of breath where you have to stop and catch your breath. And it helps get those muscles in your chest and your lungs to practice expanding, and it helps move things along. So absolutely, going for a jog helps with health. And if you would collapse after a couple of minutes, I don't understand where the confusion is here for them.
Do you honestly think how far a person can jog is a good measure of their health? No.
It's not necessarily that it's a good measure, but it can be a measure of health, I think. And I mean, don't get me wrong, it's not the only measure, and it's not a particularly reliable measure, but I don't think that it hurts to use that as an indicator of fitness, at the very least, for how long you can jog for. And I personally am also talking jogging in the way of how long can you do it until you like can't catch your breath, and where you're struggling like that. There is a bit of jogging where, especially on concrete, it can cause joint pain. That's an issue that I'm having right now working around, and I found that on days when I'm feeling like my joints are hurting from the running some, because it is a high impact, and jogging may not be quite as high impact, but it's high impact enough that I go like for a speed walk and walk as fast as I can, and you can still get out of breath doing that. So I do think that your ability to, like, for a set distance to walk and move without getting out of breath is an indicator of health. I do.
It's a measure of their stamina, of which I don't have much at the moment, but
stamina is in relation to the conditioning of your muscles and how much air your lungs can take in, isn't it? It's related. It's related to your cardiovascular health. And to a certain extent, your pulmonary health, right? I'm not a doctor, but this is my understanding.
It doesn't mean I'm less healthy. Once again, you're demonstrating that you have a basic lack of understanding of what health is. Most experts agree that health is holistic, and we talk...
Okay, holistic meaning whole body, whole, a culmination of multiple things. So wouldn't the ability to jog in the distance that you can jog for, wouldn't that fit under the holistic umbrella? If we're talking holistically means multiple parts, right? Looking at the entire picture, the whole picture. And they already said that there are like 50 different definitions for health. So are you telling me that none of them include your stamina?
About things like the salutogenic model. I imagine you don't know what that is, but maybe look it up, because you might realise then that you're talking nonsense. You don't have to be able to jog to be healthy. Plenty of people who jog are unhealthy, and loads of fat people run.
That none of those cancel out that jogging can help facilitate indicators of how healthy you are, at least for your fitness level. And that model that they said, I didn't even fully catch the name. They didn't spell it. They didn't put anything else there. It seems like they are, and they didn't explain it. For someone that wants to explain, whenever they have studies or something to reference, they have no problem explaining it. They have no problem pulling out, cherry-picking information and giving it out, or just completely misrepresenting the information. But when it comes to something that I feel like might end up contradicting what they say, they give no real indication. I have no idea how to spell the model that they said. Like, you know what, we're going to try though. First I need to hear it again.
Holistic, and we talk about things like the salutogenic model.
Salutogenic model. So I actually wasn't super far off, but someone got it. Okay, so salutogenesis focuses on holistic health measures to promote both mental and physical wellness in the hopes of preventing illness altogether, bringing about an overall healthier lifestyle. What is the salutogenic approach to health? The salutogenic model, the emphasis is put on the factors which cause global well-being. It focuses on creation and maintenance of good health rather than to look for the cause of specific diseases. This is the opposite of the pathogenic model, which focuses on risk factors involved in disease generation. So we're just going to take a quick look at the Wikipedia article because it seems like the most digestible way that we can approach this first. Salutogenesis is the study and origins of health and focuses on factors that support human health and well-being rather than the factors that cause disease, pathogenesis. More specifically, the salutogenic model was originally concerned with the relationship between health, stress, and coping through a study on Holocaust survivors. Despite going through the dramatic tragedy of the Holocaust, some survivors were able to thrive later in life. The discovery that there must be powerful health-causing factors led to this development of salutogenesis. The term was coined by Aaron Antonovsky, a professor of medical sociology. The salutogenic question posed by Aaron Antonovsky is, how can this person be helped to move towards greater health? So, your talk of the salutogenic model, if anything, from what I'm reading this, because it's all about promoting health behaviors and stuff, wouldn't jogging add to that? Am I wrong? Like that, viewed his work primarily addressed the fields of health psychology, behavioral medicine, and the sociology of health. If anything, the salutogenesis model seems to be contributory towards the jogging as a promotion of health behaviors. There was no talk of risk factors on this. It wasn't like the salutogenic model would, and I apologize, it's not a complete video without my dog demanding my attention. But the salutogenic model talks about promoting better health. Well, jogging would promote better health, wouldn't it?
I'm not sure.
Okay, so the comment says, this totally baffles me. So are you saying that being fat doesn't increase your blood pressure or put pressure on your heart?
Which part baffles you, but that is exactly what I'm saying. Fat doesn't put pressure on your heart. We carry fat in our adipose cells. They tend to be just under the skin and the abdomen, buttocks, hips, arms, and various other places. So I know there's this kind of theory that fat around the heart is bad for you, but there isn't actually any evidence that fat around the heart impacts its function or its effectiveness. As for blood pressure, there's no evidence that being fat causes high blood pressure. There is an association between living in a larger body and having high blood pressure, but this association could be caused by any number of reasons. One obvious one is that the inflammation caused by the stress response could increase your blood pressure, and weight stigma causes stress.
The amount of fat acceptance rhetoric in this one TikTok is more than I can handle. And even in the description, it's like, for more information, please read the first 2 books by Lindo Bacon. The evidence is in there. Well, one, I think Lindo Bacon does end up citing some articles in their book, but Fat Dr. UK, surely you can cite a few articles of your own. Both of those books at least the first one is at least 10 years old, and is referencing even older studies. So it's not super relevant anymore, even if it was a legitimate evidence source. But this, like, they're just putting claims out there, and it's all just couched in this fucking rhetoric. And I don't even know how to respond. Oh my god. We've seen those medical shows, medical clips, where they show, like, heart of a healthy person and a heart of an obese person, and we can see the increased fat. It's not just in adipose tissue. There is visceral fat. Wait, is it... Visceral fat is the one that's around your organs, right? As opposed to adipose fat, right? I think so. Anyway, regardless, we can see the fat around the organs, which is definitely different than the fat just stored just under the skin. The pressure on the heart is talking about, because the heart pumps, and I say this like they don't know this. They're a doctor. Of course they know this. They're just purposely obscuring information and purposely misrepresenting shit, and it's pissing me off. The heart is responsible for pumping blood to all areas of the body. And if you are heavier and just the act of walking requires your heart to beat faster, that in essence would put more pressure on your heart, would it not? Just, it hurts. It hurts my brain.
This comment right here is...
Okay, the comment says you can go to the GP with a sore eye and be told to lose weight.
Why this middle-aged, non-binary doctor finds themselves on TikTok on a daily basis. Not because I like being on social media, because I don't, but because doctors, GPs, nurses,
Okay, no, I'm calling bullshit. To a certain extent, you do like being on social media. You like what you call talking to the trolls because it gives you a sense of superiority. Like, we can see that. Don't tell me you don't like being on social media. That is some fucking lying bullshit.
Anyone within the medical profession, really, have stopped focusing on health and started focusing on weights. Within, I would say, the last 20 years of my career, once upon a time, how much a person weighed didn't really factor in to a GP consultation. And now...
And part of the reason why that's changed is because times have moved on, we have done more studies, and we have seen the bigger impact that weight plays in different illnesses. That being said, to a certain extent, I do understand this overfocus, especially with certain doctors, on weight. I did have a doctor like that where I was having, and I think I've mentioned this before, I was having issues with involuntary movement, and their advice was that it's like, well, I noticed that you're, I think it was 193 pounds at the time, you're overweight, maybe you should focus on losing that first. Turns out, and I was also complaining about, like, severe fatigue, turns out I was low in some electrolytes. And by increasing my iron intake, that helped. Like, it's that, and it ended up being a nurse practitioner that ran the test where we found that out. And it's just, there are some doctors that do overly focus on weight to the detriment of all things. And so, to a certain extent, yes, you do need to advocate for yourself in those situations where it's like, that is unreasonable to not look at anything else. And for those things, I do think that there are concerns. I think for a lot of feminine health sort of things, insisting on at least some preliminary test based on what you think it is, based on, this is one of those situations where I don't really like Dr. Google, but having a couple of ideas of most likely situations, not jumping straight to some very rare disease, but if you, say, have issues with heavy flow periods or whatever, doing a little bit of research beforehand saying, I would like to be tested for endometriosis or what have you. I don't know if there are tests specifically for those things, but coming with a couple of your own ideas and advocating for yourself to at least get whatever test is needed for a couple of those things, or asking, like, what are some other symptoms that you would look for? These are the different symptoms that I'm having. I've noticed that these are also aligned with this particular disease, and having an ongoing conversation about it rather than just taking, if you feel like you're being brushed off, making a case like it is an academic paper of sorts to where you can cite a bunch of evidence based on your understanding. There are some cases where the doctor may clear it up and say why they don't think that you have that based off these things that would rule out that particular illness. But doing some prior research to advocate and insist on a conversation rather than taking the doctor's like route judgment does pay off in some circumstances. I've also had, though, far more doctors test for like very common things typically before they say, work on losing weight. I still have some people say work on losing weight for me, and it does make sense, especially if I'm complaining about joint pain or something. Losing weight does help with that, because I've thrown out my back a couple of times, and so there's been this, you need to lose weight, you need to work on back strengthening muscles because I have weak back muscles. That's a legitimate thing to tell your patient if they're coming to you with issues with back strains and hypermobility and they're complaining of pain, to say losing some, and they're overweight, to say lose some weight and focus on strengthening this area of the body. That is a reasonable prescription for what you should do to aid in prevention of this in the future and to aid in the betterment of it now. It's not think of your doctor's appointments as a little bit of a conversation. I think doesn't hurt. So coming with your ideas, listening to what the doctor thinks is going on, and if they line up, great, and if they don't, talk about why you think that it might be this and why they think it's this and not this. That's not unreasonable. Participating in your health helps the doctor treat you better. And I don't mean treat you better as in nicer, I mean treat you better as in zeroing in on what the issue is.
It seems to be the centre of the consultation. Why is that? I ask myself. And the answer is because weight stigma has become normal practice, and doctors don't understand how much damage they are causing.
I think this is one of those things where it kind of goes back to where they say, you shouldn't have to advocate for yourself. Advocating doesn't necessarily mean that you are at odds with the doctor. Advocating means that the doctor has their idea, and you, based on what you know of your body, what you've been experiencing, and any research that you have done, may disagree with them. And the advocating can be a conversation. It doesn't have to be a fight.
So here are some
So the comment says, could you do some on weight and pregnancy?
Beautiful facts about pregnancy and weight. Number 1, fat people have been pregnant and giving birth for millennia. Number 2, pregnancy and childbirth are not a disease. They are a natural stage in life that many people go through. The medicalisation of pregnancy and childbirth has benefited the population as a whole because it has reduced infant and maternal mortality rates.
So, I agree that, pregnancy isn't a disease. It is, to a degree, a medical condition because there are elevated risks and potential harm could be done to both mother and child. based on whatever it has because the mother is pregnant. For example, falling down the stairs is dangerous for anyone, but there are additional factors to be taken into account when it is a pregnant person that falls down the stairs. So it's not to say that it is a disease, but it is a condition, kind of, and I don't really like comparing it to obesity, but kind of like obesity in that there are more considerations to take and more tests that need to be done regularly based on the condition of the person. And this is where pregnancy and obesity differ, is that, pregnancy, it's about protecting not one life, but two. And it isn't something that needs to be changed so much as something that needs to be accommodated until it's reached its completion. Obesity needs to be done in such a way that it needs to be reduced and prevented.
However, it has led to its own set of problems. I would argue that weight stigma is one of the main problems that pregnant people face today. Fact number 3, there is no evidence to suggest that fat people cannot get pregnant or deliver a baby safely. Fact number 4, focusing on weight and weight loss during pregnancy is far more dangerous than leaving people as they are. So
unfortunately, when it comes to pregnancy, this is really far out of my wheelhouse. I'm going to leave that there. For those of you that can speak to this, I would highly encourage you to put it in the comments down below. I'd love to read them. I don't have a whole lot to say on this, not because I don't think that there isn't anything to comment, but because it's so far outside of my wheelhouse, and I've already taken up a lot of this preliminary recording time, and I've noticed that if this recording gets too big, my recording software, my editing software will crash more often. And quite frankly, I want to move on to the next video. But if you have something to contribute on this, I would very much like to see it. I'm having a hard time putting anything into words because it feels so far outside of my wheelhouse.
This is actually
So the comment says, I don't know anything about the research, so forgive me if this is a stupid question, but do you think it's a risk factor for any negative outcome? What?
Excellent question. We're talking about risk factors now rather than causation. My question to you would be, are you talking about disease prevention or are you talking about health in general? Either way, I would argue that it doesn't make much of a difference. If you're talking about specific health conditions, then we'd need to get into the specifics, but I'll give you an example. Let's take heart disease. You can actually use a risk calculator to determine this yourself. QRIS3 uses the epidemiological evidence that we have about risk factors for heart disease and turns that into an individual-based risk assessment score.
So I'm curious about this. I know I just said I didn't want to do any more research, but since they are giving us something specific, let's go ahead and look. Alright, I'm going to do this for myself. So something that is worth noting is that you have to put your body mass index, or like your height to your weight. I had to look this up. These are rough numbers because I am an American and I use feet and pounds. But this, yes, even by this risk assessment, height and weight play a factor. My risk of having a heart attack or stroke within the next 10 years is 0.4%. In other words, in a crowd of 100 people with the same risk as you, 0 are likely to have a heart attack or stroke within the next 10 years. But that is partially because of my age. This is done more for older people. But also, my heart age is 35, even though I'm 31. So that's interesting to know. And it's good to know because part of that, I think, is my weight. I'm still overweight, so bringing that down would bring down my risk because I'm on borderline between obese and overweight. But I'm going down, and I'm going to keep working on it. But this Q3, one of the things that they do take into consideration is your BMI. They even give you your BMI.
Now, it's not psychic and it cannot tell you the future, but you can compare the risks in people of different weights as long as you keep everything else the same. Why not have a go and see for yourself? It turns out erectile dysfunction carries a higher risk than weight.
Okay, but weight still contributes. So let's say we'll leave everything else the same, but we'll give me, let's see, weight of, let's say, 300 pounds. So 136. Okay. So it ticked up by 1, and it says 1 person is likely to have a heart attack instead of 0 as before. So let's say we'll go with Fat Sapphic Bros. Weight, so 195. Everything the same, but it's strictly if I were the weight of Fat Sapphic Bros. 195, right? What is my increase? You can't even go that high! Oh my god. So the highest that we can go for this risk calculator is 180, which would be 396 pounds. Okay. So this can only, and it stays roughly the same, which is interesting. But, so modest changes, but the thing is that this thing will only calculate up to just under 400 pounds. Now, we know from seeing all the FAs, Fat Sapphic Bros is a perfect example, there are people that are considerably over this. And yet it can't calculate. It can't calculate past a certain point. Very interesting.
So sleep apnea is one of those conditions that always gets blamed on.
So the comment says, I would love if you would talk about sleep apnea.
Weight. To begin with, health professionals should not be blaming you for anything. Blame has absolutely no place in healthcare. But beyond this, there really aren't any studies that conclusively prove that being fat causes.
Once again, though, they're using that term prove. They're using that term so that way if someone is like, well, a bunch of these studies show that weight contributes to sleep apnea. Yes, but it doesn't prove it. So their point still stands.
You to develop sleep apnea. They just don't exist. But even if they did, does that necessarily mean that losing weight will somehow cure you of the condition? Because that's what we're told, right? We're told...
No, this is such misrepresentation. No one that I know for chronic conditions, high blood pressure, high cholesterol, diabetes, and stuff like sleep apnea, losing weight isn't said to cure. That's another operative word that they're using, cure. You can be put in remission, and the biggest thing that they are not talking about is, rather than the focus of remission, it's the talk about the focus of reducing symptoms, reducing issues, to the point where maybe you can do with minimal intervention, which is the focus of losing weight. They are focusing on a cure. No one says cure. So everyone says remission.
You have sleep apnea because you're fat. Lose some weight and you'll get better. Says who? We don't know whether the weight itself is causing the problem or if there's another perfectly logical explanation.
But the thing is that whether the weight causes the problem is irrelevant. Does it exacerbate the situation? Weight is something that's very easy to control comparatively to other things. Lowering your weight to lower the severity of your condition would be the ultimate goal. It's not about curing. It's about lowering the issue, lowering the complications. So whether the weight directly causes it is irrelevant, because the reduction in weight reduces the severity of symptoms. Therefore, and weight would be the easiest thing to be able to directly to control. This is a complete misrepresentation of how that would work. And I know that they're a doctor. They're doing this purposely.
There's also very little evidence that this works in the long term. You know what does work though? CPAP.
But CPAP is a treatment. It is a treatment. The purpose of losing the weight is to either make you less reliant on the CPAP and to potentially be able to do without it. Not guaranteed. You are not guaranteed any of this. But the reduction of weight, it's not a matter of trying to cure. It's a matter of trying to cope with the situation much better.
So there's two types of quote-unquote fatty liver. Non-alcoholic.
So the comment was, what about fatty liver? That's all it was. That is all it said.
Fatty liver is usually benign and it just causes a raised amount of fat within the liver. Non-alcoholic steatohepatitis can cause inflammation and scarring of the liver. Fatty liver doesn't usually cause any symptoms, so it's almost always picked up routinely, either on an ultrasound or in your blood tests. It is thought to be due to insulin resistance, although we don't actually know conclusively what causes it. It's linked to lots of other conditions that are associated with insulin resistance, such as diabetes, such as polycystic ovarian syndrome. And whilst we don't know for sure, most of the evidence suggests that insulin resistance causes weight gain rather than the other way round. So fatty liver is not caused by being fat, and you do not need to lose weight to treat fatty liver. So there's two types of quote-unquote.
Okay, but regardless of whether it causes fatty liver or not, fatty liver, I believe, because at one point I looked this up, and I wish I could remember where I found it, because I think it was a fairly reputable place, but from what I remember, fatty liver is more prevalent in higher weight individuals. We see this a lot with My 600 Pound Life. If you watch enough of the episodes, you'll see a trend with a lot of the morbidly obese patients having non-alcoholic fatty liver disease. So whether it causes it or not is again kind of irrelevant, in that by the reduction of weight you reduce your risk. Am I wrong or am I not? This is another one where I'm going to call out to those of you that are more versed in this subject than I, and tell me what you think. Check out the HayesHealthSheets.com fatty liver. We gotta see this. But let's see what it says. So, non-alcoholic fatty liver disease is an umbrella term that refers to a number of liver conditions, and two main characteristics are the presence of fat stored in the liver and the fact that the patient drinks little to no alcohol, differentiating it from liver disease that is caused by heavy alcohol consumption. There are two types: non-alcoholic fatty liver disease, which is typically benign and involves an increased amount of fat in liver but no inflammation. Wait, what? Non-alcoholic fatty liver disease as benign. I gotta see. The accumulation of fat in people who drink little to... The cause of non-alcoholic fatty liver disease is unknown. Risk factors include obesity, gastric bypass surgery, high cholesterol, and type 2 diabetes. Most people have no symptoms. In rare cases, people may experience fatigue, pain, or weight loss. Over time, inflammation and scarring of the liver, cirrhosis, so therefore it is not benign. If it can cause cirrhosis, it's not benign. Can occur. No standard treatment exists. Instead, doctors will treat underlying conditions such as obesity. It's very common. But at the very least, it's not benign if it can scar the liver. Here's Hopkins medicine. Types of fatty liver disease, sometimes called silent liver disease. This is because it can happen without causing any symptoms. Most people with non-alcoholic fatty liver disease live with fat in their liver without developing liver damage. So that's what they mean by benign. So which is, well, at least they say typically benign, which I guess is not wrong. It just feels, I don't know. NASH, you may have symptoms that could take years for them to develop. Severe tiredness, weakness, weight loss, yellowing of the skin or eyes, bright like blood vessels on the skin, and long-lasting itching. So, that's what non-alcoholic steatohepatitis, which includes both an increased amount of fat in the liver and inflammation, which can lead to scarring of the liver. I don't know, it just feels... with all Hayes stuff, I can't help but feel like it's purposely glossing over some things. I think that puts us at, that puts us at the end of this one. We have gone through 3 rows, so 18 TikToks. And so I believe that puts us at just under 120 left. Yes, we still have 120 fucking TikToks to get through. This is going to be very long, but we will get through it. And yes, I did skip over this one because it's just them crying and talking about being sad, and it didn't feel relevant to the video. But I think I'm going to leave it here. I feel like there was more to say about the fatty liver video, but my brain is hurting now, and I can't. So, for raw footage time, we're at about another hour and a half, although I think a significant amount of that is going to be cut because I continued recording while I was researching and stuff. So, I guess I'm just going to leave it here. This should still be at least an hour long once everything is edited and done. Once again, I forgot to fucking weigh myself. God damn it. Oh, man. I'm still, like, finding the balance between work and school because I'm doing another requirement program to get to be a school librarian, which is what I want to be. And so I'm still kind of finding my balance between that, working my part-time position, and then taking sub jobs at least a couple times a week, along with trying to maintain, because I have a 5K at the end of the month. And so I feel like I'm kind of in that space right now where I'm trying to figure out where the balance of everything is. I am getting better at portrait drawing, which makes me very happy. I did a couple this weekend that turned out very well. I was very happy with them. Very well for me. Very well considering my lack of experience drawing portraits. So I'm very happy about that. And that's all I really have to say. I don't really have a whole lot to say about what's going on in my life, because right now it's mostly just been about finding the balancing act between chores, school, work, and hobbies, and healthy behaviors. So I'm just kind of finding my way again with that. And that's all I really have to say. And I think I'm going to leave it here. Let me know how you all are doing this week. Some people have kind of updated me on some of their health journeys, and I love seeing it. If you have something to update, even if it's not health related, if it's hobby related, if it's work related, I love hearing about things that are going on in your guys' life. So please let me know. I think I'm going to end it here. And thank you for watching, and I will see you next time.